Sorry, my name is Dave Duffy. I'm a consultant orthopaedic surgeon in Harrogate, and this is a project we started in Harrogate probably over the last 12 months, but I've used the platform of PKB to deliver. I mean, essentially, it's providing patients after surgery with digitalised, personalised videos. And there are three reasons we wanted to do it. And one was basically to improve the patient experience, pure and simple. It's an idea that I'm not aware that's utilised anywhere on any scale in the NHS or any other country. But by improving the patient experience, it provides clinical efficiency, it saves time, cost, there are environmental savings, and it's now at a stage where scalability is possible with an end-to-end delivery model that can be parachuted into any other organisation or specialty. It doesn't need to be orthopaedics, particularly with the PKB platform. And what it boils down to is something extremely simple. It's after surgery, I'm recording a personalised video message, particularly for day case surgical procedures, using a simple tablet. It requires minimal capital investment, and because it's delivered, this message is delivered via PKB, it's securely delivered via the NHS app, so there are no issues with IG. The bottom line is there are two things. One, patients, we're acutely aware, patients don't remember anything that's told to them on the day of surgery, with up to 80% of the information forgotten. We've known this for 2 decades, but we've done nothing about it. Expecting somebody after they've been anaesthetised or sedated or given fairly strong analgesia to remember what's told after their procedure is a little bit old-fashioned. But as a result of that process, it builds in inefficiencies. These patients need to come back to clinic. They have uncertainties about what their procedure was, their recovery, where they are in their recovery, and as a result, they need to come back to outpatient appointments. So by delivering a personalised video message on the day of surgery from the surgeon that they receive that evening, they get better quality information. They can play it more than once. Relatives or carers can play it, and it's delivered in real time. And as a result of improving the quality of the service, the secondary gains are that we've reduced the number of outpatient appointments. It's up to an organisation how they repurpose that clinician's time. Is it utilised in theatre time, teaching, research, or new patient appointments? And there are cost savings to be had. So it started off with a simple service evaluation where any patient undergoing day case surgery under my care was given a QR code and a survey that looked at a number of parameters, and we obtained the information through this. And what we found out was that the majority of my patients were of working age, under the age of 65. Most of them remember speaking to me after the operation, but despite speaking to me on the day of surgery, 75% felt they needed an appointment. And where I started was just to do keyhole surgery. So this is what's called an arthroscopic stacker. So if anybody has keyhole surgery, whether it be of the knee or the shoulder, this is the sort of equipment that we'd use. These cost about £30,000, and it limited the number of patients that were suitable for this method of delivering information considerably. And I would produce a report that would have images from inside the knee with before and after and a video message. But when we looked into the results of what we were doing, that where I, as a surgeon, thought the interesting part was the surgical images, it was actually not the surgical images. In 82% of the patients, it was the personalised video message where the value was. So that made us sit back and redefine and redevelop the whole process and strip out the surgical images. So we went from using a £30,000 piece of equipment to a simple iPad to record a personalised message after the procedure. Now, asking a surgeon or a clinician or anybody involved in clinical medicine to record themselves and give a patient a video message is a bit of a culture change. So we have a very simple model called the ARIS model in Harrogate that provides a backbone. And if you go through these 4 stages, you can give all the information within 90 seconds. So the first thing is the introduction. Make sure it's personalised to the patient so they know that it's not a generic video, that it's to them. And it just in this digital day and age, keeping a digital solution personal, I think, is very important because people can feel they're on a conveyor belt The second most important thing is to reassure them. Tell the patient everything's gone well, or we've done what we said we were going to do. Clearly, if there was an issue, if it had not gone well for any reason, patients wouldn't be put on this pathway. Then you get into the main body of the message, which is the information specific to that patient, post-op instructions, recovery milestones. And then the final thing is to wrap it around with the safety message, what to do if there are problems, who to contact, how to contact. And if you follow this IRIS model, introduction, reassurance, information and safety, most messages can be completed within 90 seconds. And to do it on the PKB platform is very simple. I log on to the patient, and then go to the add file section. It automatically brings up the take photo or video, and you record and send. Now, wrapped around this personalised video message are a number of FAQs, because from just personal experience, I know 80% of the questions I was being asked in clinic at a later date were all the same. When can I drive? When can I get my wound wet? How long do I need off work? So as attached to the video, the personalised video messages, we have a number of FAQs. And again, all of these are short, normally about 45 seconds long, just so the patient can access whatever message or whatever FAQ is relevant to them. This is an example of one of them. They've been designed in a very generic way so they can be reskinned or rebranded if other organisations want to use them.
When returning to driving after keyhole surgery or knee arthroscopy, you've got to ask yourself some basic questions. Initially, can you get into a car safely with no discomfort? It might be worth checking that you can use the pedals and practice an emergency stop without hesitation. But fundamentally, when driving, you've got to be honest with yourself. You've got to be able to perform an emergency stop without hesitation should somebody pull out or step out in front of you. This may be as little as 2 to 3 days, but be honest with yourself.
So we've done a number of the FAQs. We've now got them for knee surgery, shoulder, foot and ankle, gynecology. We're doing them for general surgery and urology, just to provide a database or a library of these. Now, when we looked at the combination of the personalised video message and the FAQs, basically 92% knew what their weight-bearing status in relation to knee surgery was after the surgery. Everybody knew how to manage their wounds, and everybody knew when to start activities such as driving. And as a result, we've gone this combination of both a personalised video message and the FAQs. We've gone from a situation where 75% of patients felt they needed a further follow-up, and we've reduced that down to 15%. So all patients now undergoing day surgery under my care are not routinely brought back to clinic, but provided with a 3-month PIFU. In terms of scalability, I started on what I would call tier 3, which was the video, the report, the surgical images and the FAQs, but that vastly reduced the number of patients this was appropriate to. We've massively expanded that footprint now by going to this tiered situation, and we're on tier 1, where we're concentrating just on the video message and the FAQs, so it doesn't need to be arthroscopic surgery. We had rapid scaling within Harrogate, with orthopaedics, gynecology, general surgery. There's scoping for use in urology, anaesthetics preoperatively. This is, again, as I said, we've done FAQs for a number of specialties. So, it's the same model of delivery is the same irrespective of the surgical specialty. This is a hysteroscopy one, just to give an example.
Your hysteroscopy procedure, we would expect you to make a really quick recovery. There are some things to look out for, some things that are normal, and some things we'd ask you to seek medical attention for. We do expect you to have a bit of crampy, like period pain. Some people can have a bit of vaginal bleeding. That can last for a couple of hours, or it can be something that lasts longer, up to a week. We would expect it to get gradually lighter. However, if you do experience more heavy bleeding, or if ever you're unwell with any of your symptoms, please do seek more urgent medical attention. We would recommend that you use pads, not tampons, during your recovery, and we'd recommend that you can have sex again once the bleeding from the procedure has stopped. It may be that as part of your procedure, we have taken
So just to move things on, just to put the, so in terms of scalability, when you look at the number of follow-up outpatients performed in 2022-23 in England alone, it was 65 million. There is a big push nationally from central government to try and reduce or cut these number of follow-up outpatient appointments. Now, you're not going to do that with just being more efficient. You've got to look for a cultural change of how you give to a group of patients who are seeking information. Are there different methods, platforms, or cultural ways of doing that in order to have an impact on this 65 million? We're now at a stage where we've got an implementation pack that includes process mapping, controls, FAQs, capital investment, and most importantly, the DPIA. We're supporting other trusts, both within Yorkshire and outside Yorkshire, and GERF want a webinar that is being arranged for September because they see the scalability of this as a real asset, because it takes little capital investment, but can have a significant impact. And I'd say it occupies that rare space in the NHS. We've seen him significantly improving the quality of care provided to the patients by giving real-time information that they can access more than once. But as a secondary gain, we're realising significant efficiency savings. And just as a final thing, we were lucky on the back of that to win HSJ Digital Awards about 6 weeks ago.
Thank you, Mr. Duffy, and thank you so much for your time. I know you're incredibly busy, so we really appreciate you coming and sharing that really innovative work there, and congrats on the HSJ award.